Manipulation of spine requiring anesthesia, any region. Spinal manipulation under anesthesia, SMUA, is performed to treat spinal dysfunction and alleviate neck and back pain. The induction of anesthesia reduces muscle tone and the natural reflex actions so that the spine can be manipulated more effectively to restore joint function and reduce pain. Manipulation under anesthesia, including application of fixation apparatus, dislocation excluded. The patient is positioned supine and given general anesthesia. Following full evaluation, the physician manipulates the shoulder to achieve the appropriate range of motion. A fixation apparatus may also be applied. Manipulation, elbow, under anesthesia. Following the induction of general anesthesia, the physician evaluates the elbow. The elbow is manipulated by stretching, rotation, and other maneuvers to gain the appropriate range of motion. Manipulation, wrist, under anesthesia. Following the induction of general anesthesia, the physician evaluates the wrist. The wrist is manipulated by stretching, rotation, and other maneuvers to gain the appropriate range of motion. Manipulation, finger joint, under anesthesia, each joint. Manipulation, palmar facial cord, i.e., Dupuytren's cord, post-enzyme injection, e.g., collagenase, single cord. Following the induction of general anesthesia, the physician evaluates the finger. The finger is manipulated by stretching, rotation, and other maneuvers to gain the appropriate range of motion. Manipulation, hip joint, requiring general anesthesia. The patient is administered general anesthesia. If manipulation is performed to increase motion, the physician applies gradual pressure in the desired direction. The gradual pressure releases adhesions or scar tissue, increasing motion. Manipulation of the hip joint is a closed procedure, requiring no incision. Manipulation of knee joint under general anesthesia includes application of traction or other fixation devices. After general anesthesia is administered, the physician bends the knee and applies gradual pressure until the desired range of motion for the knee is achieved. Traction or other fixation devices may be applied. Manipulation of ankle under general anesthesia includes application of traction or other fixation apparatus. The physician performs manipulation of the ankle with the patient under general anesthesia. The physician pushes, pulls, and maneuvers the foot, ankle, and leg to treat a stiff ankle. The physician may apply traction devices to the ankle to help perform the manipulations. Traction is removed. Manipulation of temporomandibular joint, TMJ, therapeutic, requiring an anesthesia service, i.e., general or monitored anesthesia care. Reduction of procedentia under anesthesia. The physician reduces a rectal prolapse, procedentia, to a patient under general anesthesia. The physician performs a manual reduction of an incarcerated rectal prolapse by pushing the prolapsed segment into the anus under the relaxation of anesthesia. Pelvic examination under anesthesia, other than local. The physician performs a manual examination of the vagina including the cervix, uterus, tubes, and ovaries. During the examination, the patient is under a general anesthesia because of the patient's inability to tolerate the procedure while awake. Foreskin manipulation including lysis of preputial adhesions and stretching. The physician treats adhesions between the uncircumcised foreskin and the head of the penis that prevent the retraction of the foreskin. Adhesions are broken by stretching the foreskin back over the head of the penis onto the shaft or by inserting a clamp between the foreskin and the head of the penis and spreading the jaws of the clamp. Marsupialization is the surgical technique of cutting a slit into an abscess or cyst and suturing the edges of the slit to form a continuous surface from the exterior surface to the interior surface of the cyst or abscess. Sutured in this fashion, the site remains open and can drain freely. This technique is used to treat a cyst or abscess when a single draining would not be effective and complete removal of the surrounding structure would not be desirable. Marsupialization of urethral diverticulum, male or female. The physician repairs a urethral diverticulum by creating a pouch, marsupialization. In a female patient, a longitudinal incision is made in the anterior vaginal wall of the female and the borders of the urethral diverticulum are raised and sutured to create a pouch. The interior of the sac separates and gradually closes by granulation. The urethra is closed over a catheter and the vaginal wall is repaired with a layered closure. In a male patient, a cystourethriscope is inserted into the urethra and the diverticulum treated in the same manner, but through the perineum. Marsupialization of sublingual salivary cyst, ranula. The physician incises and removes the mucosa overlying a cyst on the floor of the mouth. The roof of the cyst is removed and the remaining sides of the cyst wall are sutured to the mucosa, creating a pouch. The saliva drains through the pouch. The pouch shrinks in size to a small opening in the floor of the mouth. Saliva from the sublingual gland flows through this opening. Marsupialization of cyst or abscess of liver. The physician creates a pouch with the lining of a cyst on the liver. The physician exposes the liver via an upper midline abdominal incision through skin, fascia, and muscles. The cyst is incised and suctioned with care not to contaminate the abdomen. Electrocautery is used to resect the cyst wall to allow open drainage into the abdomen. The abdominal incision is closed with sutures. Marsupialization of pancreatic cyst. The physician approaches the pancreas through the lesser sac of the omental bursa or through the transverse mesocolon. The cyst is located, and the anterior cyst wall is incised. The cut edges of the cyst are sutured to the skin edges, establishing a pouch of what was formerly an enclosed cyst. The remainder of the operative site is sutured in layers. Marsupialization of pancreatic cyst. The physician approaches the pancreas through the lesser sac of the omental bursa or through the transverse mesocolon. The cyst is located, and the anterior cyst wall is incised. The cut edges of the cyst are sutured to the skin edges, establishing a pouch of what was formerly an enclosed cyst. The remainder of the operative site is sutured in layers. Marsupialization of Bartholin's gland cyst. The physician makes an elliptical excision over the center of the Bartholin's gland cyst and drains it. The lining of the cyst is everted and approximated to the vaginal mucosa with sutures, creating a pouch. Marsupialization prevents recurrent cysts and infections.